Welcome everyone to a little seminar on healthcare information technology and new healthcare laws. The purpose of this presentation is talking about how the advent of IT services make them more efficient and hopefully safer and cheaper for the hospitals as well. Pretty much a little bit of background on how this all came about. The Obama administration decided they wanted to use a little bit of a stimulus package called ARRA, American Reinvestment and Recovery Act. Its little brother spawned the little electronic health record. You can also have a piece to that which is called HIE, which is Health Information Exchange. At the facility in which I work, we are currently working on the electronic health record and soon to be doing HIE as well. As you can see, it was quite a sum of money. It was approximately $19.2 billion that was going to be dispersed amongst the facilities that wish to go that route. To get that money after the reimbursement, after the implementation, you had to do what is called meaningful use. And there are several guidelines. These are just a few that I researched and come up with. Use of a certified EHR in a meaningful manner, which we happen to have a Cerner product here. Submission of information on clinical quality measures and other measures in a form and manner specified by the Secretary. I assume that's a government office. And utilization of certified EHR technology that is connected in a manner that provides for the electronic exchange of health information to improve the quality of health care, such as promoting care coordination. That's a mouthful. But those are the items that the facility has to basically prove that they did in order to get the reimbursement for the EHR and HIE expenses. Basically, over the course of, well, we got maybe 2 years to get that done in order. I think the deadline was 2014. So I think we're well on our way. Tenet as a whole has done a good job, but I imagine there are other offices that are not doing as well. Today's presentation basically has 3 main points. First of which is safety. The second is talking about the efficiency of EHR and electronic records. And the last is privacy laws. We'll begin with safety. Safety pretty much encompasses patients as well as clinicians. The main point that I think most folks are going to appreciate is clear documentation. You're not going to have to worry about reading doctors' chicken scratch. Who would want to try to decipher something like that? It's terribly difficult to read. So hopefully that won't be the case as we move forward. Some of that stuff will be electronic and it'll be electronically signed. Prescriptions and orders are pretty much in the same manner. They will be electronically ordered, electronically fed into the record system itself, so there won't be any need to try to decipher handwriting. Also, patients will wear armbands with a barcode on them, so in the safety effect there, you will be able to scan those armbands and administer the medication with the armband system. That way you also eliminate errors and typos in that manner. The last point of safety, and it's probably the biggest point, is timeliness. Obviously, the electronic record yields itself to being available 24/7 so long as it's working. Obviously, systems have downtimes, but in today's world, uptime is probably 99% of the time. It enables the clinicians and the physicians both to dictate care in a manner that is timely, especially in an emergent situation to where you need something right now and you have access to it pretty much anywhere you go. Efficiency, timeliness kind of leads us into that. We'll start off with environmental benefits. Obviously, you're not going to use as much paper. You're going to be going green. Money savings from reduced power consumption. A lot of places have been able to take their IT infrastructures and reduce the size, especially with more efficient servers and doing a cloud and outsource and farming and that type of thing. Obviously, the biggest is probably reduced paper use. You're not going to be printing everything like you have in the past. Also, reduction in equipment. Less printers. You may add some PCs, but overall you probably will have less to work with. Computer-based versus paper. Well, obviously, paper's paper, and being on a computer, you can go to any terminal pretty much in the facility, access what the physician or clinician needs and work on it from pretty much anywhere. That is definitely a big help in being efficient, is that you don't have to go to any one particular area. You can go anywhere a computer is available, which is pretty much anywhere in most hospitals today. And also it's accessible 24/7, even from a physician's home. That's a big deal, and most physicians have pretty much demanded that that be an option that they have. Our next point is real-time charting. Real-time charting allows you pretty much to say, hey, I'm doing the chart right now. They can go in and review it, see what they need to see. Whereas a paper chart, they have to flip through the chart, but in order to get an electronic method, the chart would have to be scanned and then put into a scan repository for them to review later electronically. So they don't have the option to be able to go home and read a paper chart. Privacy laws. This is kind of a biggie. Anyone who works in the healthcare industry has heard of HIPAA, Health Insurance Portability and Accountability Act. The biggest part of that as an IT person would be the accountability piece and the laws that we have to govern ourselves by to protect health information, PHI. In addition to PHI, we now have ePHI, which is the electronic means of protected health information. Who holds the responsibilities? Where are they, and why do we need to do that? Well, responsibilities lie pretty much with anyone who uses it, supports it, maintains it. Those responsibilities lie within the four walls of this hospital, as well as anyone who uses it at home needs to keep it secured. Why do we do that? We don't want patient information that is private and being exposed to public eyes and potentially creating security issues with someone stealing someone's identity or looking at information that would be inappropriate. User training. There is a ton of user training. Everybody knows that user training is probably the biggest burden of this type of thing, but it is mandatory. It is a good thing to have. It is drilled into us every year, but it is something that helps prevent issues in the long run. In concluding, the changes pretty much affect us all. I would say that, from an IT perspective, from a user perspective, from whatever perspective you want to look at it, there's anticipated user training for the electronic applications as well as training for the HIPAA stuff. IT applications, generally there are changes in systems. We have to learn that. Those things have to be set up and supported. But overall, the changes can be stressful, but not overly so. It's definitely worth the battle. In reviewing all the points we made earlier, safety, efficiency, and then the laws themselves, they definitely support the clinician and the patient. The efficiency kind of rolls into safety, kind of rolls into the HIPAA as well. If those things work together well, then the system will definitely be more efficient and provide better patient care. And that pretty much wraps it up for me. If you have any questions, please email me. This is a very brief presentation, so feel free with any comments. Thanks.